seat.
Thank you.
And what can I do to help you today, Miss Cole?
Basically, I was put onto lithium carbonate medication by my doctor about a week ago.
Okay.
Because I suffer from depression. And I have tried other medications in the past, such as citalopram and duloxetine. However, these haven't really helped me.
Okay.
My doctor told me to take 2 tablets in the morning of lithium carbonate and 2 tablets in the evening. And he did run through the procedure with me, however, I'm still a bit unsure about some things.
Okay, well if you tell me what you're unsure of, we'll go through it.
First of all, in the leaflet that I was given, it said I need to have regular checks on my thyroid and kidneys. However, I did have a check a couple of weeks ago, so I'm not sure whether it's still necessary to have further checks.
Okay, well firstly in terms of your kidney checks, your kidneys are actually important for getting rid of lithium from your body. So if your kidneys weren't functioning correctly, then obviously lithium's going to build up in your body and this can cause problems. So it's still important to go for regular checks on your kidneys even though you've had a check already. Secondly, in terms of your thyroid, did you say?
Yes.
If your thyroid doesn't work correctly, then you will experience symptoms such as fatigue and drowsiness, and these are also symptoms of depression. So if you do experience these, you might think that, okay, my lithium's not working correctly because I'm feeling depressed again, when in actual fact it might not be that, it might be that your thyroid is the problem. So it's important to keep going for thyroid checks also.
Okay. Also, I do have trouble swallowing tablets, but I've heard that you shouldn't really change the formulation that you're taking. Is that true?
Yeah, what it is that there's different brands of lithium available, and because it's such a strong medication, you shouldn't change the brand because different brands can release different amounts of the drug into your body, if you understand what I mean.
Yeah.
And so different brands can cause your blood levels to actually fluctuate, and this can be dangerous. So it's important to stick to the same brand. However, if you do experience difficulty in swallowing tablets, like you said, there is actually a liquid formulation available. To get this, you'll have to go back to your GP, who will then prescribe the liquid formulation, and that's the formulation that we will dispense to you every time you come back to the pharmacy for your prescription.
Okay, I'll definitely ask my doctor about the liquid form then.
Okay.
He also told me that I need to carry an alert card, which I'm not really sure what that's for.
Okay, basically an alert card is something which you should carry with you all the time, so it might be best to keep it in your purse and take it everywhere with you. And this will contain information about yourself for starters, so your name and your address, contact details, and it will also contain information about your lithium therapy, so your dose, strength, formulation, and basically every time you come into contact with them, the healthcare professionals, whether it be a doctor, a dentist, a nurse, anybody else in hospital, you need to present this card to them so that they know that you are taking lithium, so that then if your GP, for example, or another nurse does try to prescribe you any other medication, it will help you to ensure, it would help them to ensure that that medication that they're going to prescribe to you doesn't interact with your lithium therapy.
Okay.
So basically it's just for safety, really, that you need that. Has your doctor mentioned anything about a record card?
He has, but I'm not really sure what that's for either.
Okay, a record card is slightly different from an alert card. It contains more information about your checks, so checks on your kidneys, checks on your thyroid. And again, it's important that health professionals see this card so they can take note of any checks that you've had recently, or any checks that you're due to have, just to ensure that everything's done at the right time and your blood levels are taken. And it'll also help them to see how your treatment's going, whether you're benefiting from it, whether your dose needs reducing or anything like that. So again, it's just a precaution.
Okay, I'll be sure to carry those then.
Okay.
Also, if the lithium becomes too high in my blood and builds up, how will I know, and what should I do about it?
Okay, if your levels do become too high, it's most likely that you will suffer from symptoms of toxicity. These can include like symptoms such as blurred vision is one of them, confusion is yet another, fatigue, muscle weakness is yet another one. These are all listed in your patient information leaflet if you do need to refer back just to familiarise yourself. But also, we find that with a lot of our lithium patients, they can't recognise these symptoms on themselves. It's very hard to pick up as to whether you're confused just because you're tired or confused due to the medication. So it might be a good idea to actually alert your friends and family of these symptoms so that then they might be able to recognise them on you. Does that make sense?
Yeah.
Okay, and if you do find yourself suffering from any of these, then it's really important that you do go to your GP as soon as possible, or alternatively you can call NHS Direct and they will tell you what to do from then on.
Okay. Also, my doctor did mention about not changing my salt intake in my diet.
Okay.
I was wondering if there's anything else I need to do dietary-wise.
Okay, in terms of salt intake, that can cause the levels of lithium in your blood to fluctuate. So it's important to keep that constant. So if you've always sprinkled salt on your food, on your dinners or whatever, it's important to keep doing that. Just keep it constant. You don't have to cut it out altogether. That can actually cause problems. So just keeping it constant. Has your doctor mentioned anything about caffeine intake?
Not really.
Okay. Do you drink teas and coffee?
A little.
Okay. Well, in terms of caffeine, lithium can actually enhance the effect of caffeine. So you might find that you can't sleep at night. You find yourself it takes longer for you to fall asleep. If you are experiencing problems such as those, then you need to actually reduce your caffeine intake. Don't change your lithium dosage or anything like that. Just reduce your caffeine intake. And also you need to keep hydrated, so drink plenty of water. Do you drink alcohol, Miss Cole?
I do.
Okay. It's probably best to actually avoid alcohol altogether if you can.
Okay.
But if you do find that you want the odd drink here and there, it shouldn't do too much harm. But lithium does increase the effects of alcohol also, so you might feel more drowsy and more tired. So it's important to not take in too much alcohol.
Okay.
Okay.
I'm much clearer on everything else now, so thank you for your help.
That's no problem at all.